Morning everybody and welcome to today's South East Perinatal Mental Health webinar focusing on research in practice. Just a couple of housekeeping notes before we kick off. So just to remind everybody to keep your lines on mute and turn your video cameras off until we're asking questions and discussions. We'll just have the cameras on for the speakers if that's okay. Also to raise your hand if you've got questions and also to put comments and reflections in the chat function. And please feel free to put messages in the chat function in terms of who you are attending today and kind of sharing a bit about yourselves. And just to remind everybody, we are recording the webinar so that it can be made available to those that aren't able to attend today on our website. So if you're not happy to be recorded, please keep your camera off at all times. Thank you very much. Okay, thank you. Next slide, please. So I'm just going to run through the agenda, but just to say, unfortunately, normally, obviously, Jenny and I, Jenny Walsh as South East Perinatal Mental Health Clinical Lead, and I do a double act. But unfortunately, Jenny is off sick with COVID at the moment, and I'm just recovering from COVID. So please bear with me today. But we wish Jenny a speedy recovery. So just in terms of the agenda for today, I will give a bit of a national update and some of the key resources and training and education coming up. Then we have got Monica Lackenpool, who's going to be talking to us about the Champions Project. Then Bosky Nair will be giving us an update of the European cross-border project addressing perinatal mental health illness, and that's entitled PATH. And then Jules McCoy and Donna Rutherford will be presenting on the South East Perinatal Research Forum. So as usual, a packed agenda. Please obviously feel free to put questions in the chat, and hopefully after each speaker we'll have some time for questions as well. Okay, thank you. Next slide, please. And next slide again, please. So obviously this was presented at the last webinar in March, but just a reminder that the 4th Maternal Mental Health Services Implementation event is taking place tomorrow morning. So please make sure, if you haven't already done so, that you register. It's obviously aimed at those specifically involved in maternal mental health services, but also the wider pathway, anybody coming into contact with that. So it's the national event. There are further details on the slide, and please make sure you are registered for the event. Okay, thank you very much. Next slide, please. So actually on the day of our last webinar, the publication of the independent review of maternity services for Shrewsbury and Telford was published, the Ockenden report. And really, I just wanted to highlight that. Hopefully all of you will have seen it and, you know, kind of reviewed it. But just to kind of remind everybody of all the work that's going on in the maternity pathway at the moment, and also how that interfaces with perinatal mental health, particularly in terms of the actions. Again, there's a focus on perinatal mental health coming into play with maternal medicine. And so that work will be going forward in the next couple of months. So really just wanted to highlight that for people. Okay, next slide, please. And this will be coming out in emails to you, but there is a national benchmarking survey for 0 to 5 mental health services across England. So the deadline for submissions is Friday the 10th of June. As I said, there will be emails coming out regarding this, but they are looking to undertake a data collection focusing on the provision of mental health services directed at children aged 0 to 5. And then on completion of the exercise, there will be a bespoke report for each of the 0 to 5 mental health services based on the data collected. There's more information available via the website on the project, and there's key contacts there as well, but there will be further emails coming out to South East stakeholders on this. Next slide, please. And just to highlight a couple of awareness weeks coming up. So next week is the UK Maternal Mental Health Awareness Week. There's lots of information on the website, and you know, good to highlight to other stakeholders and also patients and the public. And next slide, please. And also then the following week is Mental Health Awareness Week, and the focus of that this year is loneliness is the theme. And again, further information can be found via the Mental Health Foundation website. Next slide, please. So a couple of resources. There is some work that's been done through the Maternity Clinical Network in terms of translations of information that can be found on our website into different languages for sort of various bits of information for the maternity pathway. And then there's also a report on perinatal mental ill health, the experiences of women from ethnic minority groups. And that's a journal article that can be found via the link, but is a good read. Thinking about the health inequalities work that we've all been doing. Next slide, please. So I don't obviously expect you to be able to see the detail of this slide, but this will obviously come out in the slide pack. But this is just a resource pack really in terms of information for health professionals that may be working or coming into contact with refugees and people seeking asylum, thinking about their health and well-being and also safeguarding issues, and particularly with the situation that we're in at the moment with the Ukraine crisis, probably a good resource to look at. Next slide, please. Then there is currently a call out for recruitment for a study that's going on in terms of the mental well-being of fathers and partners. And there's details of information there. The recruitment ends on the 1st of May, so only a couple of days to go. But if people want to highlight that to dads and partners that they may be in contact with through their services, the details can be found on the slide. And then there's also the King's Fund. I've also done kind of a report of one of the studies that they did with Health Watch in terms of how does health and care system hear from people and communities. So thinking about that patient and public engagement, and the link to the findings are there. Next slide, please. This is an article within the Maternity and Midwifery Forum. So this is an article by our own Jenny Walsh. So it's in response to the work that we did on the bias trap, and the link is there in terms of thinking about the spread of the bias trap film and our work on health inequalities. And so there to be shared, and an interesting link. Next slide, please. Okay, on to education and training. So just to remind everybody that the South East Perinatal Mental Health Academy is up and running in terms of the training events available, as well as resources, useful links and latest news. Obviously, this is specifically for South East colleagues. So if you're working elsewhere in the country, then please obviously get in touch with your regional mental health team to find out about education and training in your area. But just to remind all South East colleagues to go to this link to find out about education and training. And I'm just going to run through some of the education and training we've got coming up. Next slide, please. So first of all, 5 to Thrive, and I think we did a brief slide on this last time, but just a bit more information about this. So 5 to Thrive, building and maintaining healthy brains. So this afternoon we have a South East System Leads meeting for ICS leads, introducing the 5 to Thrive programme to them. And then on Thursday, the 12th of May in the morning, we have a 5 to Thrive webinar, which is open to everybody within the perinatal mental health pathway and wider, so obviously maternity health, visiting, etc., looking at attachment, trauma and resilience and the importance of relationships from birth and beyond. And the link to book onto that training webinar is there. I will put it on the chat in the chat after I've finished presenting as well in a minute. But just to say, if you're not able to actually attend on the day, if you sign up to the webinar, you will be sent the recording. So it's worth signing up even if you can't attend in person on the day. Obviously, the webinar forms part of our 5 to Thrive training programme, which has a number of training events. So it starts off with the overarching webinar, and then there will be further training in terms of developing practitioners and also champions within the region. So a really great piece of work that we look forward to taking forward over the next couple of months, and further details will be coming out about that. Next slide, please. We've also got the Gypsy and Traveller cultural awareness training, which is delivered by Me Learning, is available through the Academy. So that's an online training programme of which there are 4 modules, and we're encouraging, as part of our health and equalities work, for as many people as possible to sign up to these modules and complete them in terms of cultural awareness and competency. So please do go onto the Academy and sign up for that training and complete it. Next slide, please. We also have linked in with cultural competency, the cultural competency and safety workshops, which are being delivered by Sheffield Maternity Cooperative. And the dates there are on the slide in terms of the 2-day workshops. We're running them 4 times on the following dates. So please do register for those training dates. There is still availability. Next slide, please. And then also, and many of you, I'm sure, who are on the webinar today will have attended the National Perinatal Mental Health training course. It always has absolutely rave reviews. It's a fantastic course, and we still have some places available for the 7th and 8th of July. Attendance is required in full for both days, but again, please register your interest via the Academy. And just a reminder that obviously all the training that I'm talking about is specifically available to our South East region, and if you're out of region, please get in contact with your own region directly. Next slide, please. And then again, this is a very detailed slide, and I don't expect you to be able to read it, but further information will be coming out in the next couple of days via email. We will be sending out full details for expressions of interest to register via service leads and managers. So my big ask is, please do not submit individual requests for the perinatal mental health postgraduate module. It will be coordinated through services and managers. But the great news is that we have been awarded 12 places in the South East for the first 4 cohorts, which are taking place on the below dates on the table, so in September to February, with assignment submissions in March. There is expectation that obviously you will be available for the full period of time in order to complete it. It has to have management, service management sign off. And as I said, we will be going out to service leads to coordinate those submissions for expression of interest. And the deadline for nominations will be Thursday, the 26th of May. But just to make you aware, so do speak to your service manager if you are keen to participate on the postgraduate module. Next slide, please. And then just to make you aware of some external training that we've received. So there is a session on video feedback for perinatal mental health taking place on the 27th of May and June the 10th. It is free, and it's a 3-hour Zoom workshop. So please do look at the link, and there'll be further information provided if you are interested. Okay. Next slide, please. Okay, so that's our whistle stop update for this morning in terms of resource, and that obviously you will have all the slides, so you can go and get the detail from them at a later stage. But without further ado, I would really like to introduce Monica Lackenpool, who is going to present on the Champions project. I'll hand over to you, Monica.
Thank you very much. Hopefully everybody can hear me. Thank you very much for inviting me to the seminar this morning. And you'll be wondering why I'm really presenting a topic really around homelessness and children experiencing homelessness at your webinar. But as we know, everything starts early in life. And our project has been running over the last 18 months, really, to try and look at what the impact of COVID has been on children who frequently move and who are exposed to trauma due to moving and having an insecure household. Next slide, please. So this is the project, the Champions Project, and we have a number of partners, third sector organisations who've been working with us, and we're doing this work in partnership between UCL and De Montfort University as well. Next slide, please. For those of you who may not know, when we talk about children in temporary accommodation, it's a large number. It's not a small number. There are about 96,600 households, and that's small at the moment, living in temporary accommodation. When I say small, what I mean is there are lots and lots of hidden children who are not counted in that number. So it's going to be much, much larger than that. And when we talk about households, we don't actually know the number of children in each household. So we say 96,000 households, but actually within that 96,000, how many children are within each household? 50% of people living in temporary accommodation are children, yet we don't really talk about the impact on children very much. And this is increasing, and we know in the current times with poverty as well, the situation we're in, this is just going to creep up. So we're in a situation where if we don't take hold of this, we are really going to have problems for the children and the adults for tomorrow. Next slide, please. So all of you here will know, the early years are the most important part of a child's life. It's during this time that the child is developing, their brain is developing. They learn about interactions with other children, social interactions, how to play with other children, how to behave properly. And also it's at the time when they're actually quite vulnerable to different stresses. And, again, in the forum we're here today, you'll be completely aware of those stresses. If a mother's not feeling she has the capacity to look after her child, if there's trauma going on because you don't know where you're going to live, if you have siblings who've gone through trauma as well, that's going to affect that young child who then doesn't feel safe and secure within their home, and then they're uprooted and they're uprooted again. So they have multiple effects on these child. So it's really important that any child, for their brain to develop, for their interactions, social interactions to develop, they feel safe and they have a routine. Next slide, please. But how can you do that? If you look at this environment, an overcrowded situation where children can't really put things in boxes, they can't really have a cupboard, they've got nowhere to play, nowhere to develop. And some of the children are really learning to walk while they're on beds rather than being able to walk on the floors and the floor space that we have for them. Next slide, please. When I think of a child who's living in a home, I think of three things, and I try and simplify. We have lots and lots of literature about child development, but just when I'm thinking about it, I think if you were a child, what would you be doing within your home environment? And what does a home mean to you? What you're doing is you're seeing what's around you. So can you see those pictures that are put on the wall, those handprints that are put on the wall, or are you seeing mold on the wall and dampness on the wall? So what is the visual imagery that you're getting from your surroundings? Smell is really important when you're developing. So what sort of smells are you smelling as a baby or as you're growing up? Are you smelling, the nice cooking, or are you smelling the smoke or drug addicts around you, and whatever pollution and smoke is coming through your door and getting into your bedroom? Are you smelling the pollution from outside getting into your room that you can't ventilate your room and get out again? And what are you hearing? Are you hearing beautiful music? Are you hearing the birds? Or are you actually hearing people shouting and screaming because you're in a bedsit where it's shared? You're in a B&B, you're in a hostel where actually it's just noise and you can't make sense of that noise. So if you were just to think of yourself a child, seeing, smelling, hearing, such key things that are part of your development that when you're in temporary accommodation are impacted on so dramatically. Next slide, please. These are some of the impacts of homelessness. So the impact on the parents, as we've talked about, if you have families who have stress and they actually then may have perinatal mental health illness, they may have other traumas. Some of them who are refugees and asylum seekers, many can't speak the language, or they've been trying to find a place to live, or other traumas that they're going through. Many feel isolated as parents and very, very hungry at the moment with food poverty as well. So how do you parent? How do you have the capacity to parent when you're already going through that stress yourself? We know that there's an increased rate in premature birth, low birth, stillbirth as well, in families who experience temporary accommodation. And impacts on children. There's a low GP registration rate because often children will go and families will present to GPs and will be turned away because they don't have an address. Higher hospital admission rates, missed immunisations, and this has really increased during COVID. All of these things have gone up. We'll talk about some of the evidence in a minute, but developmental delays, children not being able to speak, children not being able to be potty trained, and then ending up being sent home from school because they're not school ready. And then behavioural problems. How do you learn how to behave with another child if during COVID you've been isolated within a home and not really played with other children, or you're so frightened you're going to lose something that your brain becomes hyper anxious? And this further on in life leads to substance abuse, suicide risk, and you get into the cycle of homelessness again. Next slide, please. This is just a slide showing some of the different illnesses that we know that children are exposed to. So respiratory infections, we know that there's an increased rate of asthma, particularly skin ailments, because of the dirt, because of the cockroaches, because of the mice. You have an increase in eczema, increase in skin ailments. Diarrhea, we're seeing a lot of diarrhea. And again, people don't really talk about this because it's not recorded. But a child may get diarrhea because the food cannot be stored in the fridge, or there's no cooking utensils that are clean. And they get diarrhea, they lose weight, and then how, with food poverty, can they get back to normality again? And some other chronic physical conditions as well. Next slide, please. So if you just have a look at the slide, we've really put this together to try and show you, we talk a lot about trauma, but what does that really mean for a child? And why do we talk about it in the context of homelessness? A homelessness that people don't talk about for children because they don't think kids as homeless. But actually, it's very, very traumatic, as I keep saying, not knowing where your home is. And it does make you become quite hyper anxious in your behavior. As you can see, children are then thought to be hyperactive, oppositional, spacey or shy, just because of the trauma that they've been through. So if you have lack of security, lack of routine, absent parents, or broken relationships because the parents are stressed, you're constantly needing to catch up. You feel like you're behind, so your self-esteem is broken. You have broken links with your wider family, so your support structures aren't there, and broken friendships because you keep moving nursery or you keep moving school. Next slide, please. So in the Champions Project, what we were doing here was we were collecting evidence that we will actually be submitting to the all parliamentary groups about what has happened in COVID. And this has been done through qualitative interviews with families, with professionals, surveys, quantitative surveys with families and professionals, and with also other informal ways of gathering evidence through artwork as well. We've been trying to have one-to-one discussions with families about what the solutions could be for them, and having roundtable discussions as well with professionals, and trying to develop a campaign really to say this isn't just about adult rough sleepers, but fitting in with the early years agenda. How do we bring in health, education, and housing together to tackle this problem? Next slide, please. So some of the findings, which won't really be astonishing to you, and we have a huge amount of data, and so I'm really in this very quick presentation giving you a glimpse of just the highlights, but we've got a lot more that we could share with you. We know that there's been limited food availability, but this actually got worse during COVID, and we still have food poverty. So how do we have those children who have been nutritionally depleted catching up? Because again, we know that in the first 1,000 days, that's a critical period for bone development, but actually, will they ever be able to make that up? Keeping food clean, families, whether it was in COVID or whether now, no access to fridges, we're not able to keep food in cupboards. We're seeing pictures and stories of cockroaches that are coming out of cupboards. And like I said, transmission because of mice as well. No consistency. So how do you, we talk about parenting interventions or parenting support programs, but how does a parent actually give a routine to a child when A, they're trying to find a home all the time, or they're uprooted constantly? Space and hygiene, no space, very, very tiny. I mean, I talked about this the other day, and I was saying, you know, if we took a picture of some of the industrial parks where there are blocks of homes where these families are living, and you looked at it next to a picture of battery farming, it's extreme, but actually what's the difference? They're in 30-meter square rooms with shared toilets, with nowhere for their child to actually walk or develop. And how do you keep that clean as well? No play areas, so a lot of the play areas within some of these hostels and hotels were shut down. Children did not get to play inside or outside, and again have been depleted of these normal developmental sensory inputs that they would have. And laundry, trying to wash clothes. So, you know, we end up in a situation where we say, that child, is the parent neglecting the child because the child's dirty? Well, if you can't get to a laundrette and there's no laundry machine in your hostel, you're only allowed to use it once a week. How on earth do you keep your child clean? Even if you're washing the clothes in a sink in your room, you put it to dry, the moisture then gives your child breathing problems. And mold all over the walls. We're seeing lots and lots of stories about mold that cannot be removed, but you go from one moldy environment to another. And the difference here, people say, well, you know, people in poverty have a lot of the overlapping problems and you cannot divide them. But the difference is when it's not your own home, you can't do anything about it because you don't know if in 2 days you'll be uprooted or you're going to be there for 3 years. Next slide, please. Sanitation and hygiene, I won't spend too much time on this, but the real thing I wanted to bring out here was really the fact that there are issues with toilets. In a shared toilet, how do you potty train a child? And we're hearing some horrific stories about children sitting in cupboards to go to a toilet because they were too scared to actually get out of their room and go and share a toilet with other people in the B&Bs. And again, this delays their development, but also puts a fear of using the toilet, which they may never be able to get rid of later in life. Next slide, please. Overcrowding, again, from the context of the talk today, we hear a lot about pregnant mothers actually sleeping on the floor, getting back problems, getting health problems. When they come home from a cesarean section, they have their baby with them. Sometimes they're not giving them a cot and they're co-sleeping, which is extremely dangerous. And then they could be uprooted in 2-3 days when they've lost all their family networks and all their support systems, which then is going to be a risk factor for perinatal mental health problems. Break in relationships, if you're completely stressed because you're overcrowded, or you're trying to constantly find a job, you can't get onto the internet, it causes break in relationships. Stress we've talked about. And children are not used to being with other people. So COVID has made this a lot worse. The children are becoming quite anxious, social anxiety, not wanting to go out, and quite clingy with their parents. So again, how do we integrate them into education systems later on? And this feeling of unsafe, and we'll keep coming back to this, the feeling of not knowing where you are, not knowing where you're going. This isn't your home, this isn't your environment. Next slide, please. So coming to children's mental health, I picked up on this a little bit, but we talk about perinatal mental health, but the child's mental health is being affected, and we don't really talk about mental health of children under 5 very much, but children are getting anxiety, they are getting distressed, they are getting features being scared and fear, which we might call, we look for in neglect or child protection issues. Actually, these children living in these environments are feeling the same sort of feelings of fear and the unknown. And the pandemic just made it worse, and parents are very, very worried about how they're going to deal with these problems and how do they equip themselves to deal with these stresses on their children. And school and nursery also are not equipped to deal with this. So nobody is. So these children are left like with nobody really holding their mental health. So what do we do with that? Next slide, please. So again, coming back to mental health, but thinking about it from the well-being side of things, we have these quotes here. The child is having mood swings, they're withdrawn, they've got temper tantrums. Mummy doesn't like me. They're scared that their parents don't like them or they've done something wrong. That fear that they're going to be told off all the time because they're not quiet, because somebody might complain about them in the room next door. And parents having to sleep on the floor with their families and with their children. Next slide, please. So just this is just a framework you may want to consider using. This is something we just put together called the SHE framework. Every child should be safe, healthy and educated. And these are the three things that actually a child has the right to. And if we can think of how we support the children in this framework, then we have some hope of moving them forward in a positive way. So please do utilise this framework that we've come up with. Next slide, please. Professionals also had challenges, and we know it was very difficult because people were having virtual appointments. They weren't health visitors, midwives weren't actually able to see families during COVID. There were limited options for health visitors, and now a lot of the health visiting service has been withdrawn, and we don't have homeless health visitors everywhere in the country as we would like to have. So who is really the link worker? Who is really the person who's linking the families with the healthcare services? Very limited data sharing across the country. Some areas of good practice, some areas where there is no notification system. We don't know when families are moving and data is not shared at all. And we know that with child protection, we talked about data sharing, but actually between education, health and housing, this still is not happening in many areas. And so professionals were really having to deal with basic needs of families, just trying to get them food, trying to get them a GP, rather than actually doing what you're there to do, which is help the health of the family health and the mental health and well-being and physical well-being. Next slide, please. Just to end with really a couple of slides about some other work that we're doing, which is really, we're trying to engage with the children more. And we're saying, okay, we've done the evidence gathering from the families and the professionals, but let's hear from the children. And children will not talk to you in a way that, you know, just an interview or anything like that. So we're holding art workshops with children. We're trying to see what does a home mean to them. And then through this work, we will create designs and magazines and use their work with street artists really to give them a voice and create a campaign really for them. Next slide, please. So what we're doing now is we're feeding into the all parliamentary groups. In July, we will be having a policy workshop where we will be debating this more about focusing just on children, building on the early years agenda and trying to make this really an area that we should really be talking about more in a targeted way. We want to call to action, safe sleeping equipment. Families are not given cots, some are co-sleeping, as I mentioned, ending of mixing families with single adults, really having what we call tag groups, temporary accommodation groups, in different areas where different sectors and disciplines come together to talk about the needs of the families. Next slide, please. One thing the families have said is that they want community link workers, somebody who they can call up, say, I have a problem, and they will link them to the different services, care navigators, community link workers. This is the top of their list that they've been asking for. GPs, emergency departments are not well trained to really recognise that somebody coming through that door may be going through trauma because of homelessness, and their reactions may be because of this, or they may not be registered, and how to deal with that situation. GPs often don't even ask if people are homeless or not. We need more people trained to understand how to access families who are in temporary accommodation, and we need to bring people together, as I mentioned, in these integrated cross-sector groups. Next slide, please. So we're working with many different partners across the country, and so thank you very much for inviting me here today. We have a website, the Champions Project website, where you can see a lot more about what we're doing, and we want to develop a consortium, really, a national consortium, to bring in different perspectives and create a campaign and be an advocate for the children and the families and share learning between us. Next slide, please. So just to end with the last slide, the Champions Project says, we say all children should be safe, healthy and educated. They say we are not invisible, so don't leave us behind. No child should go hungry, cold or deprived of learning. All children should have a home. Thank you.
Thank you so much, Monica, for a really informative talk. Getting a lot of feedback. Can please people put themselves on mute if they're not? Thank you. I think it's really important for us to be aware of bits of work that are being done in other areas. There's so much overlap with perinatal mental health, and also shows the power of research to highlight issues and inequalities, which is so important for us to address. Are there any questions from the audience, please? Please feel free to put your hand up and switch your camera on. There don't appear to be any questions in the chat. So if you'd rather, you can pop them in the chat.
And if people want to email me at any time, my email is m.lackenpaul@ucl.ac.uk. So always happy to be connected to people offline as well.
Thank you very much, Monica. Are you happy to pop your email address in the chat? Would that be okay? Okay. Yeah, so comments in terms of great to spotlight the work, etc. Support the campaign. Fabulous. Okay. Well, if there aren't any questions, I'm sure there may be some that follow in the chat. But then I would like to say thank you very much to Monica. Thank you for taking time out of your busy schedule to join us today, and wish you a good rest of the day. Thank you. So can we move on to the next slide, please? So we're now going to have a talk from Dr. Bosky-Nair, who's going to talk about PATH project, which is the results of the 2Cs Perinatal Mental Health project, which was funded by the EU. So I'll hand over to Bosky. Thank you very much.
Thank you, Liz. Can you hear me all right?
Super, thank you.
Wonderful. Thank you so much for inviting me to this event to talk about PATH. My name is Bosky-Nair. I'm a consultant perinatal psychiatrist, and I work within the KMPT, which is Kenton Medway Partnership Trust. And I also am involved in the PATH project, which is essentially a collaboration between partners within the EU. There are 4 countries involved, including the UK, and we are trying to address perinatal mental illness, particularly the mild to moderate end of the spectrum, through this project. Next slide, please. So the idea behind this project was conceived in 2016. We were trying to look at the interface between primary and secondary care, particularly when it comes to a gap in service provision, and also looking at strengthening primary care when it comes to, perinatal mental illness and how women with PMI can be supported. So we applied for funding, and we were offered a grant through the Interseas 2Reg. Interreg 2Cs program, and I'll talk about 2Cs in my next slide. Essentially, it is a cross-border collaboration between England, France, Netherlands, and Belgium, and it is to try and create healthcare and social innovation projects across these regions. Next slide, please. So in this slide, you can see the areas that I'm talking about. The 2Cs region essentially covers the coastal regions across the 2Cs, which is the Channel and the North Sea. So it includes the southern coast of UK and the eastern area. So very much relevant to our stakeholders here. And areas within France, the Flanders region in Belgium, and the western coastal area in Netherlands. And the reason we went for a cross-border approach is because we knew that there was a similar prevalence rate of PMI in the 4 2Cs countries, and there was a need for a wider collaboration and a wider approach. And there have been initiatives set up in each of these countries, and we could learn from these initiatives and improve on them and find better solutions. And there's obviously a quite a diverse experience and knowledge and expertise in this area that we can tap into, and that was the reason we felt a cross-border approach would be really helpful. Next slide, please. So this project was brought together by our lead partner, Health in Europe Centre, and in addition, we've had several partners in the UK, Netherlands, France, and Belgium participating in this project, and they have a range of skills. They come from a range of organizations. We are the only NHS trust as part of this project within KMPT. In addition, we have Devon Mind, Southampton City Council, the employment support team within the council, the Kent County Council, Institute of Health Visiting, Bournemouth University, which provides the technical and technological skills needed for this project. And amongst our European partners is obstetric teams, midwifery teams. There are people involved in public health and universities. AP in Antwerp is providing us with research and statistical input that's needed for this project. And in addition, we have 22 observer partners as well. Next slide, please. In terms of the key ambitions of this project, so we wanted to create a multimedia campaign which can help improve awareness of perinatal mental illness, reduce the stigma, and enable parents to prepare themselves for their parenting journey. And we want to create a suite of resources, both online and also resources that can be used in training. So training healthcare professionals, parents, community support workers, employers. So quite an ambitious plan of creating a range of resources that can help support women with perinatal mental illness. Next slide, please. So as part of the engagement process, we conducted several focus groups in the 4 countries. We engaged more than 500 people, sought feedback from mixed groups of people thinking about becoming pregnant, pregnant women, and postnatal people, birthing people, and obviously partners and family members. And in addition, we spoke to employers and employees in terms of trying to garner their experience of the challenges of navigating through parenthood and employment. And also we had groups of healthcare professionals in various sectors, and having a mix of organizations really helped to try and gather a lot of information from various groups, and it was all filtered down to the resources that we have created as part of this project. We also undertook a social listening exercise, so really trying to gauge the discussions that's happening on social media and what forums were prominent and what themes emerged from these discussions. And we also ran a survey of 1,001 parents to feed into our multimedia campaign. And this survey essentially took place during the pandemic, so we could ask some questions around their experience of pandemic as well. We were quite lucky to get a lot of interest and engagement from various people, and we could create what we called our parent panel that helped us to review the content that was created specifically for parents and families. And so co-production was very much central to creating this project. Next slide, please. So I'm going to talk through the different ambitions and our journey so far and how we've gone about them. So with our multimedia campaign, we were very lucky to be involved with 2 very passionate mental health advocates, Sandra Igwe, who is the founder of the Motherhood Group, and Mark Williams, who is very passionate about fathers' mental health. So they were the face of our campaign, and they spoke about their lived experience, which was translated into animations, and that was part of our campaign and included within our hub. And we also did some radio and TV coverage talking about the project, talking about perinatal mental illness as such, and trying to tackle the stigma of the condition and increasing awareness amongst the public. And we also did several publications, and an overall reach of more than 40 million was achieved as part of this campaign. And obviously there's still conversations ongoing and a lot of activity that we're still taking part in. Next slide, please. So we've been able to create an online hub, which you can access on this particular web page, which is on this slide. And I've added those details towards the end of the slide as well. So the hub essentially comprises of information, several articles about perinatal mental illness, and there are specific sections, firstly for the UK, France, Netherlands, and Belgium. And in addition, we have created sections for healthcare professionals, employers, and families. We have tried to include several videos that we filmed within simulation suites, so trying to create certain settings that we've included within each of these articles to try and explain the condition and help improve people's understanding about the different perinatal mental illnesses. And obviously there are a lot of additional information very specific to PMI in specific groups. So that's within the professional section, within the employer section. There's information on what employees can need to look at and what are their rights, and the employment standards, and there's also checklists. So really a lot of rich information is collated and included within the hub, and I would certainly encourage you to share this information within your networks, because that would hopefully help the people who require this information. Next slide, please. So our partners in the EU have also been creating several resources, such as apps and e-learning. MatiClick is a really interesting resource where it's about trying to help women during their pregnancy stage to look at the networks that they can access help from. So really starting to have those conversations very early on to prepare them in their parenting role. Next slide, please. So we are also running training sessions specifically for healthcare professionals, non-clinical community support workers, peer support training, and also a training aimed at mothers and families. So our partner at Devon Mind is running the Matricens course. So some of the training has been face-to-face, but because of the pandemic, the majority of the training that we've held has been online on virtual platform. And this is free training for people to attend. And again, a lot of information is on our hub. So if there are people within your networks who are interested in accessing this training, they're more than happy to contact us. Next slide, please. Our partners, IHV, Institute of Health Visiting, have been involved in fathers and partners awareness program for healthcare professionals. So they've teamed up with Bournemouth University, who has provided the technical input, and using really innovative methods such as VR, virtual reality, to try and help provide a more immersive experience of these situations. So essentially, we are trying to make the overall project really attractive for people to engage in and take benefit out of it. And also our partners, the Southampton City Council, have been running several workshops with employers and trying to offer support, employment support for expectant and new parents. Next slide, please. So finally, I'll just mention about the evaluation of this project. Obviously, research is a significant component of the project. While we are putting this intervention in place, we want to see how the project is developing and what is the evidence around this particular intervention. And obviously there are several strands of the project. So we have divided it into several studies. So we've got the Path Multimedia Campaign study, which was launched last year, just prior to the multimedia campaign. And it was aiming to look at sample of pregnant women, so women in the perinatal period, either pregnant or in the postnatal period, and their partners. And we did a pre and post survey about their awareness and the literacy and understanding about perinatal mental illness and the stigma of PMI, and we have been quite successful in recruiting people for this particular study, and the study is now complete. We've also been running the Path OR study, which is the Path online resources. So the resources that we've created, we are trying to evaluate them again through a pre and post survey. And these are aimed again at people in the perinatal period, both mothers and as well as partners and healthcare professionals who will be accessing these resources, and healthcare professionals as employers, so employers of women of childbearing age group. So this study is currently open, and there's more information on our website. So we've also submitted to the HRA on another study, which is the Path TS, or Path Training Sessions study. So we'll be trying to evaluate the efficacy of our training sessions that we are offering, again with a pre and post survey. Next slide, please. So really that brings me to the end of a snapshot of this project, and feel free to follow us on Twitter. I've put our Twitter handle there, and our website, and obviously these slides will be shared with you. So if there are any specific questions about the project or anything else you'd like to know, do feel free to ask, and I'm happy to answer any questions. I've also put my email there. I can be contacted if you have anything you'd like to discuss or take forwards. Thank you.
Thank you so much, Bosky. Do we have any questions, Bosky? Quiet crowd today. They're not normally this quiet. Thank you. It's really interesting to hear the work that's been done today, and it'd be great to have you back when the elements of the projects that are still continuing and in process are finished.
Yeah, absolutely. I'll be delighted to come back, especially when we've had the the data from all of the studies looking at these interventions. Yeah, absolutely.
Fantastic. Thank you very much. Okay, so positive comments in the chat. Give one last opportunity for any questions, and if not, we will move on. Thank you very much for your time this morning, Bosky, and as we say, we'll have you back at a later date to give a further update. Thank you very much. Okay, next slide, please. Thank you. So our last speakers for this morning are Jules McCoy and Donna Rutherford, who are going to talk about one of the new local initiatives that they've set up in terms of the South East Perinatal Research Forum. So I will hand over to Jules and Donna. Thank you very much.
Thank you.
Thank you, Liz. Shall we take a moment to introduce ourselves, Jules? So I'm Donna Rutherford. I'm a consultant psychologist and I work in the maternity mental health service across Hampshire and the Isle of Wight.
And I'm Jules McCoy. I'm the lead midwife for perinatal mental health for the SHIP LMNS, which is Southampton, Hampshire, the Isle of Wight and Portsmouth.
So next slide. Oh, I get to do that kind of Chris Whitty thing. So I'm hoping that it will be possible to share this video and that the sound will come through for people. I just wanted us to start with a couple of minutes of reminding ourselves about the importance of research. So if you can press play, that would be fab. Thanks. No, I don't know about others, but I can't hear that sound.
Haven't got any sound. Should we give a couple of minutes? Yvette, are you okay to try and enable sound? And if not, I will try and do it myself.
Oh, thank you, Yvette. Sorry.
Yeah, I will do that. Apologies, I'd missed the video, so I will enable sound and share again, and fingers crossed.
Star.
Thank you very much. There's always technical challenges.
There's always one, hey?
And I think before that, I was a little bit afraid of research, and I was a little bit worried about sort of patient involvement, but I could really see from this patient how valuable it had been to him to be involved in the research, how he was part of a group for patient involvement, and how giving that opportunity for people to be involved in studies and both for the, might be beneficial both for themselves and for future patients, and how positive some of the patients felt about that.
There is a famous quote, I can't remember who it is exactly, that about, without research, eventually everything just stagnates. And I think the advantage to patients is you've got people who are, around them, who are inquiring, who are relatively up to date. Patients have they often have an opportunity to get involved in research themselves, which may be of benefit to them, or more typically to fellow patients or patients' children or whatever. So I think that's a thing, and I think probably the actual outcomes are being cared for by people who are interested in pursuing outcomes, finding out what best practice is. I think those are the advantages, really.
The benefits to patients are that they're involved in the most cutting edge of medical science, that they get the best possible treatments, that is evidence-based, and that as an organisation we are seen as leading that forefront of the medical science.
I absolutely implicitly believe that research active organisations have better outcomes for patients, and that message is probably the key driver for staff being engaged with care and with research in their care. I think that the reason that it makes such a difference to have research active members of staff is it promotes a whole questioning attitude to what they do in their day jobs. And making research integral to clinical care is very important in improving those outcomes, I think.
We'll just give a couple of minutes for Yvette to get her screen back up.
I was going to say, you very kindly got it so that I can see kind of the notes and things, but I'm not sure whether people can, whether just in order to be able to read the slides, we might, if it's possible, to go back to that full.
Are you able to get to the full screen share? If not, I can do that.
Apologies, is it not on the?
No,
It's
not.
on the presentation view, so very kindly I can see what's coming next, which is great, but
So can everyone else.
I'm just wondering whether people can read it.
because you've got it on a double screen. If you swap the display view, then it'll change it.
Bear with me one moment. My system is now objecting to me doing anything, which is not very helpful.
Yvette, do you want me to try and share? Would that be helpful?
Let me just hold on. I
I'll
love it
remember
when
next time, Yvette, to give you warning about any videos that I embed.
Yes, please.
Sorry.
It's no worries, we will get there. Just bear with me one moment. Right. Apologies for the technology, but we will get there.
I was going to say, well, if not, we'll carry on as it was.
Okay, I'm hoping we may be there now.
Yeah, we're back up and running. Thank you.
Fabulous, thank you.
Thank you. So yeah, so there's an animation on this one. So I guess just kind of, allow those things to come up on those next. So again, it's picking up what that video said, that there's a benefit of doing research, and that's a benefit to our patients, it's a benefit to staff, and it's a benefit to organisations. And it's for these reasons that research allows us to improve the outcomes of the care that we offer and people's experience of that care, because things continue to improve. It encourages innovation. It helps staff to have an increased knowledge base and skills and confidence to draw on. It helps us make sure that we're tackling health inequalities by reaching people and understanding a variety of needs to best meet those. And of course, all of that, and it came through in the video, is that for both people participating in research, people adding to the knowledge base that we have, there's an enormous feeling of satisfaction and purpose that comes from that. So research is a really important thing to do. And of course, there are a variety of ways of getting involved. I think sometimes we can think research and think this has to be kind of, me running a study or doing statistics, and all of that can feel somehow a little bit daunting. Or a little bit off-putting. And I guess today I wanted to take an opportunity to say there are a variety of ways of getting involved. So Yvette, if you can flick the next slide up for me. And here are some examples that actually it could be that there's something about the way things are done that you always just wonder about. And it might be proposing a research question and asking the right people about saying, I've always wondered about this, or, can we try that? Or, so bringing a question to someone and then allowing that to take things forward and spur us on. It might be about talking with people about studies that are happening in your area that they can get involved with, and just having those simple conversations and allowing people to know about those opportunities. That might be how you're involved in participating in moving research forward in your area. It might be that you can get involved through kind of local forums or your local research and development team in again, kind of thinking about how research gets planned, what's prioritised for research, what kinds of areas are important to you and your local population to be asking about and investigating. And of course, sharing research results. So like today, if you know of something, if you've read a paper, if you've heard of something in a talk like you have today, going away and talking to your colleagues about that, because that will inspire other people to have questions, to think, oh, we could follow that up, or we could get involved here. So actually just sharing what you hear about and the things that you read that kind of interest you, that can be great in terms of just promoting a kind of an ethos within your local area about research orientation and being curious about what we do, how we do it, and how we can do it better. So yeah, so I just wanted to kind of sow that seed really, to remember that when we talk about getting involved in research, that can be at a variety of levels, and each of these are equally important in terms of driving things forward. So Jules and I are delighted to be here today to be telling you about a forum that we're now launching. And so Yvette, the next slide, please. So our Southeast Perinatal Research Forum. This kind of came about, so I came into post in my job and joined Jules, who'd been part of the kind of pilot project prior to that, last summer. And of course, as I did that, I had this lovely opportunity to go around and start meeting people. And Jules has already mentioned that we work across Southampton and Portsmouth and Hampshire hospitals and the Isle of Wight. So I was going out to all these places and meeting with lots of people. And I was meeting with midwives and obstetricians, and I was meeting with health visiting teams and family nurse partnerships and all these professionals who were involved with people during their pregnancy and in those early months and years of becoming a parent. And we joined a well-established community of perinatal provision in the Hampshire area with our community perinatal team and our mother and baby unit. And as I was talking to all these people and asking about things that they were doing and hearing about things, just research kept cropping up, and there were little projects, service development projects or research projects that people were kind of telling me about. And I was thinking, well, this is fantastic. There's so much, and this is really rich. And then I would go away and I'd say to the next person, oh, did you know that this person's also got an interest in that? Or this person's been doing this? And they would be like, no. So there's this sense that there's lots of things going on, but it might only be in your organisation that you're really aware of it, or it might be within your professional group. So we wanted to set up something that would start to broaden our thinking and network across those boundaries. So the idea is to provide a research forum for anyone, any professional who's working in the Southeast region, who's undertaking research into psychosocial aspects of maternal mental health, infant well-being, family health. So keeping it kind of quite broad. And what we're launching is an online platform and an online forum with an idea that we would meet quarterly. And it's an opportunity really to come together to do what I mentioned, to share ideas. And Jules is going to tell us a little bit more about kind of some of our particular aims and ambitions, and then tell you a little bit more about some of the work that's already started in our area. So I shall hand over to you, Jules.
Thank you, Donna. Can I have the next slide, please, Yvette? Thank you. So as Donna says, Donna's came into post and she's brought so from meeting all these people, we've had so many conversations, and I have been involved within maternity in research, but didn't have anywhere to take it beyond my local contacts. And together we thought there's a huge gap here. We need a forum. We need to bring professionals together, and our ambitions in creating this research forum is exactly as Donna's highlighted. But we've sort of summarised some of our main ambitions as driving forward research within our region, so making us a showcase, if you like, or exemplar of the good work that's being done, sharing the amazing work that's being done, bringing all of us who are involved on whatever level that is together, and just really, within the Southeast, creating this this whole, this focus on research and improving the care and satisfaction for our colleagues as well as everyone that comes into our care. So we want to bring together people from different professions. So we want this forum to cross professional boundaries, to not to be limited to healthcare practitioners, to be open to anybody who's participating or carrying out research. So as we've got there as examples, from the county council to your universities to hospital trusts and even more. We want to work as a collective so that the research that we can develop together is on a multi-site basis. So we're getting that much greater spread of data that we're collecting, that our reach is greater, and we can have much more influence, and hopefully that our practice is really driven by the best available evidence that we're all contributing to. And obviously that will help with funding applications, because we know research by its very nature can be expensive. To offer peer support, I think for me, who's involved in research currently, I think that's one of the biggest things that this forum can really offer is a place to go and ask questions, to share your experiences, a place to just get that peer support, that, you know, touching base with somebody else who knows the sort of struggles that research can sort of present, but also sharing the joys of them overcoming them hurdles, and just offer advice as you go along. Obviously sharing knowledge of good practice, and what we hope is that through the development of this research forum, that as more and more of these little projects, big projects, all these little things that are going on, we come together, we can share that knowledge, and we can come to webinars such as this and give a platform to some of the smaller projects that might be taking place that may not reach sort of regional awareness. I've already mentioned the evidence for best practice. We all know that that's the, you know, when you come into working in healthcare and whatever speciality, we have a desire for our practice to be underpinned by the best and most recent available evidence, and this is our ability to really drive that collection of evidence and shape the future. And then obviously on a very sort of practical level, to inform our policies or procedures locally, but also to influence nationally. We can have the next slide, please. And then these are just a sprinkling of some of the projects that myself and Donna are aware of locally within our area. So these are by no means, you know, representative of the Southeast. This is literally a snapshot from what's happening in our locality. So one big piece of research that I'm currently heading up at the moment is to do with the newborn behavioural observation technique, which could be a whole 15-minute presentation in itself, but we are leading in terms of maternity services in Southampton to be embedding this within maternity, and we're the first maternity service to actually take this on as a project and look at how we can use this technique within maternity to strengthen parent-baby attunement, to improve communication, from understanding babies' communication, probably is the better term there. And the reason why that's particularly relevant to us as the perinatal webinar is that the newborn behavioural observation technique, if it's employed and you know, delivered to families and talked about with families, it's actually been evidenced to be protective of postnatal and preventative of postnatal depression for our first-time mums, but is also protective of infant mental health. And I think that within maternity, certainly infant mental health is a new and emerging theme. So the EMBO is a really exciting way forward for us in maternity. But as I say, I can't really, I'd spend the whole day talking to you about it. So I'm happy to have questions in an email. I'll put my email in the chat later on. Something else that we have just trialled recently within the SHIP area is the development and the introduction of a screening tool for perinatal mental health. It's an online tool that assesses risk assesses, triages and signposts pregnant people and their partners to the correct place on the mental health care pathway according to the level of need. And again, this is really big, and I'm not doing it justice in what I'm saying, but what I can tell you about the perinatal pathway screening tools that we are presenting at next month's forum. So I'm literally just skimming the surface, but I would really encourage you to come along next month and hear us talk about this, because it is such an exciting development that we have for perinatal mental health screening that we hope to launch nationally. So but that has been a big project that's just sort of came to an end in terms of the pilot, and that was an 18-month pilot more or less over the SHIP period, and we've just evaluated the success of the the efficacy of the screening tool and actually making an accurate risk assessment against respondents' answers. So really excited to share more about that next month. The COSY study is a piece of work that's going on locally. I'm going to be completely honest, it's not one that I know a great deal about. This is one that we became aware of quite recently, and it's about women who are accessing perinatal mental health services. But that's a piece of work that we've recently learned about that's happening locally again. And you know, it's bringing those researchers together, bringing us all together and sitting around, you know, obviously not really sitting around a room because we're online, but you know, sitting together and sharing what we're doing and how we can come in. Donna, please come in.
I just wanted to say, so other people may have heard of the COSY study, because I believe there are kind of a handful of perinatal services nationally who are involved in this one. But again, it's exciting that locally we have the opportunity to do that. So this is a study that looks at the impact on mental health and bonding with baby. The Circle of Security Parenting is a group intervention. It's a 10-session group-based intervention that's intended to help parents think about their emotions, managing their emotions, and the impact that emotions have on interactions with baby. So, as I say, you know, an exciting project that I know is being looked at kind of across multi-sites, and that's the beauty, isn't it? You know, when you know that these things are happening, you can put your hand up locally and say, we think we can be involved here. We can contribute to this, kind of wanting to just pick that up. But again, it was an NIHR funded study, and the outcomes, as I mentioned, are kind of looking at maternal well-being, but also attachment, security, infant development, you know, emotion regulation within the family. So yeah, an exciting project.
Thank you, Sue. And you, Donna, will be able to give you more there. Thank you. And then another piece of research that one of Donna's colleagues, my own colleagues, is working on is looking at women from a BAME background and how they've engaged with healthcare professionals and exploring attitudes, exactly as it says. And that's a really exciting piece of research, and it's so needed, as we see from the Embrace reports time and time again. Women with a BAME background consistently have poorer outcomes within the perinatal period. So yeah, another really exciting piece of research that doesn't automatically make you think perinatal mental health, but absolutely is. Yeah, so really exciting piece of work, and there's more, you know, research going on that we've even captured here, but we just wanted to give a sprinkling of some of the things that we're aware of, and yeah, just to hopefully, you know, share some of our enthusiasm for the great work that's going on and bring all those researchers together. Sorry, I'm waffling a little. Next slide, please. Can I have the next slide, Yvette, please?
It's now protesting, it won't move on, so bear with me. There's definitely gremlins today.
No problem. Well, when the next slide joins us, what I've actually it's a slide actually to some resources, and I guess at the top what I've put is a link to the Maternal Mental Health Alliance, which is a great, as I'm sure we're all aware, it was a really great platform for bringing together research related to maternal mental health. And the reason that we've put that right at the top of the resource list, because it's not your automatic thought when you're thinking about research, is because in their 2022 report, one of the big statements that they made was about that there is a huge focus that's needed on research. And I just think that really gives support to what we're trying to do with this research forum. So the Maternal Mental Health Alliance, as you can see, is calling on funding and those who are conducting research to prioritise the psychological impact of the pandemic on young families, and that absolutely is something that we are all very conscious of at the moment. But research in perinatal mental health is really, really important. That is a focus. So places that you can go to get some advice and support about conducting research. So on a national level, we've got the National Institute for Health and Care Research, which is one of the main organisations for finding out about how to conduct research, the sort of navigating the some of the funding pathways. And interestingly, they have what they call the Nursing and Midwifery Incubator, which is a subsection of the website that is tailored just for people within those professions and about supporting research for those professional groups. And then on a sort of smaller scale, it's really important that we remember that our local trust research and development partners are great sources of advice, support. Research can really help link you up with those people that you might need to speak to take an idea forward, to propose a research question, or to tell you about what research is going on within your locality and how you can get involved. As Don has said, research, you know, we can all participate in research. You don't have to be leading the research. Sharing what is going on locally or nationally with people that come into your care, with your colleagues, is just as vital as being the person leading the research. All of us can play a part, and research is you know, it's so satisfying to know that you are promoting the change, that you're driving forward practice in a evidence-based fashion. That's up for us at the moment.
Thank you very much, Jules and Donna. Do we have any questions for Jules and Donna? Whilst people are thinking about questions, just to say, please do share the dates with us for the forums, and we can also circulate them on your behalf. And really looking forward to having you back at some point, Jules, to talk about the NBO work, and also just to do a plug for your next session on the Perinatal's Pathway Screening Tool. It's a great piece of work. The screening tool was kind of the brainchild of our own Jenny, and as Jules says, is due to be hopefully rolled out nationally. So really look forward to hearing the evaluation work on that. Okay. So our attendees have been very quiet today. Maybe it's because Jenny's not here. So there don't appear to be any questions in the chat, and I can't see anybody's hand up, but please do raise your hand if you've got any questions. If not, I will move us on. So thank you very much, Donna and Jules, and we will circulate the date for the next forum to everybody. And without further ado, just to say our next webinar is taking place on the 25th of May, and our focus for that webinar will be fathers and partners. There's also the dates for the future webinars for the rest of this calendar year. And a reminder to everybody that the recordings are all available on the website. So if you're not able to attend on the day, you can catch up with them at a later time or share the link with others. And if you're not registered for the webinars and you've been forwarded on the invite, if you could email the England MHLDA Southeast email address to get yourself registered, that would be great. So this is very unusual for us, but there is 8 minutes remaining, which I can give back to you all before you go on to your next meetings today for a quick comfort break and a coffee. So wish you all a very good rest of day, and we will see you next month. Take care. Bye-bye.